Hi, so thank you for coming along today. So Healthwatch Bristol is a consumer champion for anyone using any health or social care service. Healthwatch Bristol is your local Healthwatch in Bristol, but we're part of a network which is headed up by Healthwatch England. So whatever area in England you come from, there is a local Healthwatch that wants to hear from you. So basically, the way Healthwatch works is we go out and talk to anyone of any age, young people, right the way through to adults, about their experiences of any health or social care service, including mental health services, which is what I'm going to talk a bit more about today. So as I knew that Claire was going to talk earlier about her work with mainly older people, I thought that for this talk I'd focus on what we've been doing with young people. So as part of Healthwatch Bristol, we've formed Young Healthwatch, and that's been formed very much with young people from Bristol and some of them from South Gloucestershire and North Somerset because we couldn't keep them out. And they've really helped us set it up, right down to the fact that I took along my iPad and my laptop to one of our meetings and just said to them, look, can you do a Facebook page and a Twitter page? Because I'm only 25, but I'm out of date. I don't know how to do it. So they did all of that. So some of the things we've been involved in is the recommissioning of children's community health services, and we've worked really closely with Bristol Clinical Commissioning Group to do that. And that's been great because it's meant young people have led that process. So we've done lots of different things around making the website, but one of my favourite meetings that we had with the Clinical Commissioning Group was when they came along to show the young volunteers that we've got their plan for the text for the website. And what they thought our young people were going to say is, this is too complicated, we don't understand the wording, you need to simplify it. What our young people actually did was say, there's a spelling mistake there and there's a grammar error there, you need to correct that, which was wonderful. So as well as doing stuff with the Clinical Commissioning Group, we've linked in with lots of different young people's organisations across Bristol who are already doing some great work around mental health and wellbeing. Groups including Off the Record and Bernardo's, Bristol City Youth Council and the Children's Hospital Youth Council. And we held last year in October a Young Healthwatch Being Me event where we did various things including a cooking workshop, a blog writing workshop and a circus skills workshop. And we did it around what it means to be you, what stresses you out, what makes you happy, what might affect your well-being. Then more recently this year we did a Celebrating Youth Voice event which brought together some of those young people's organisations that I've talked about, got them all in one room, and the young people, a bit like we're doing today, gave presentations to the others about what they're doing, and then they all had a great networking event and it was fantastic. They were all swapping like business cards and stuff like that, which was fab, with the aim of trying to join up all the great work that's going on. Obviously, I only have 5 minutes to talk, so I couldn't tell you everything that they've told me, but I thought I'd pull out something that's a key theme. I spoke to them and said, if there was one thing you would want me to say, what would it be? And it was this. So something that we've done at a lot of Young Healthwatch events and through doing workshops with groups and at schools is play a game of word association. So we would start and I would say, what do you think of when you hear the words physical health? Now, I wanted to bring some pictures because I like pictures. So I played this game with Google. Other search engines are available. So I put into Google physical health and I picked 2 of the images on the first page that came up. And those images, as you can see, are all about healthy things. And I also had lots of photos to choose from of beautiful looking men and women looking very, very happy with themselves. So that's a little image. And when you play this game with young people, they do the same. So when I say, what do you think of when you hear the words physical health? I get apples, running, carrots is quite a popular one, and things like not smoking too much and stuff like that. However, if you play the same game and you say, what do you think of when you hear the words mental health? And again, Google did the same. These are the words that you get. So these are two images that came up on the first page of my Google search, and there was a drastic contrast. So I've got this one, which is all the words that young people usually give me. Quite often the first ones that I hear are self-harm and suicide. And then all the pictures of people were more like this one. So they were people not looking very happy, not looking very healthy, not smiling. So then what I say to young people when we do this is, so why when I say physical health do we all think of healthy things and not name physical illnesses? No one says cancer, no one says broken leg. But when I say mental health, we all think of mental illness. And actually one of our young people has written a blog about that, which you can access through our website. So just to conclude, what young people want to support them with their mental health is support with their mental health, not their mental illnesses. It's not rocket science, but they want support about how to build their resilience. They want that before they get ill, and they definitely want that before it reaches a crisis point. So I think what we need to do as a city is start thinking about our mental health rather than waiting for a mental illness to come along and make us think about what it means to be mentally healthy. So that's where I'm going to leave it for today. But we really want to hear from everyone's feedback, not just about mental health, but any health or social care service, because I think that's the other thing. Mental and physical health aren't separate things. They do overlap. And those are our contact details. And I'll be around at the end if you want to talk to me. So thank you.
Thank you, Helen.